Manual handling relates to any activity requiring the use of force by a person to lift, lower, push, pull, hold, or restrain something. Putting boxes on shelves, painting, gardening, cleaning, writing, and typing are some examples of manual handling tasks. Most manual handling injuries can be prevented by designing the task to minimize risk. Instruction, training, and supervision are essential to make sure hazards are recognized and safe work methods are used. Today, I'm going to highlight manual handling hazards, risks, and safety precautions, how we can prevent musculoskeletal disorders. So, stick around. You are on the platform of Safety First Life. I'm your host, Javed. If you are visiting for the first time, kindly subscribe the channel and press the bell icon for all future notifications. And if you find the video informative, then like, comment, and share it with your friends and colleagues. The most important question, what are the basics of safe lifting or manual handling techniques? Dear friends and fellows, the basic rules of good lifting are: size up the load. Test the weight by lifting one of the corners or pushing on it. Place feet close to the object. Center the body over the load. Bend at the knees. Get a good hand hold. Lift straight up, letting the legs do the work. Don't twist and avoid sudden movements while moving the load. And lastly, set the load down, letting the legs do the work. Here, you can add up some more lifting tips. Clear a path of travel. Split the load into several small ones. Employ the help of another worker, or use a mechanical aid if the load is too large or heavy. Push a load on a cart. Don't pull it. Second important question is there a maximum allowable weight that an individual can lift? When you are restricting site supervisory staff, project management, construction team, that they should follow safe manual handling techniques, this question they are asked, where it is written, how much load an individual can lift. So, in this regard, this is an important information. You have to remember, OSHA doesn't have a regulation that addresses weight restrictions for manual handling. OSHA has, however, used the NIOSH lifting equation to evaluate manual lifts during a workplace inspection. The NIOSH equation sets a fixed weight of 51 pounds. This is by NIOSH. As the load constant that is generally considered the maximum load, nearly all healthy workers should be able to lift under optimal conditions. But here, some additional requirements. The NIOSH equation also uses other factors such as height and angle of the lift. Important points. 51 pounds, but you have to consider the height and the angle of the load. Additionally, frequency of the lift, type of hand grip, and travel distance. These are all as important in assessing a lift as the weight of the object. An alternative guide that focuses on male-female population percentages capable of performing a lift with certain characteristics rather than on maximum weight limits is the Liberty Mutual Material Handling Tables. And Oregon OSHA has a tool that provides a fairly quick and user-friendly way to assess the lifts. So these are very important points. As a safety practitioner, you have all the guidelines, references, and regulations in hand when you are going to debate, discuss, communicate, or train your workers or staff. Lifting hazard assessment worksheet based on the 1991 NIOSH revised lifting equation. Beyond this information, employers may want to contact an ergonomist for guidance on the specific operation with respect to musculoskeletal disorders. Mostly the contractors, they don't have any ergonomist, and they are not even interested to hire a third party about this critical issue, this hazardous activity, that is manual handling. Another important aspect: what activities should be avoided to help prevent MSDs, musculoskeletal disorders. Prevention is the most important strategy for dealing with work-related musculoskeletal problems. Some postures to avoid include prolonged or repetitive flexion or extension of the wrist. Number 2, prolonged or repetitive bending at the waist. Number 3, prolonged standing or sitting without shifting your position. Number 4, suspending an outstretched arm for extended periods of time. Number 5, holding or turning the head consistently to one side. Number 6, any unnatural posture that is held repeatedly or for a prolonged time. These are the activities that may lead to musculoskeletal disorders. If we are able to control, regulate, or making breaks to avoid repetitive or prolonged exposure, we can, in other words, prevent MSDs. Remember, some movements which should be avoided include repeated motions without periods of rest, repeated motion with little or no variation, repeated motions performed with great force, resting or compressing a body part on or against a surface, lifting heavy objects far away from the body, frequent reaching or working above shoulder height. Dear friends and fellows, if as a safety practitioner you will include these points in your risk assessment or site inspection checklist, you can manage manual handling, safe techniques, and you can avoid injuries related to manual handling. Those are especially MSDs, musculoskeletal disorders. For now, that's all. Thanks for watching, and don't forget to like, comment, and share the video. Hope to see you soon with a new HSC tutorial. Until then, take care. Good luck and goodbye.